Okay. Hi, everyone. I'm Katie with the Juvenile Justice Information Exchange. Thanks for joining us today. The JJIE is a nonprofit news organization for people who care about children and the law. Thank you for joining us today for a compelling and informative webinar with Benjamin Chambers, a writer and editor specializing in juvenile justice, who currently works as a communications specialist for the National Juvenile Justice Network. Prior to that, he spent 7 years working for the Multnomah County Department of Community Justice in Portland, Oregon, where he directed the local Reclaiming Futures Project, which is an initiative designed to improve alcohol and drug treatment services for teenagers caught in the cycle of drugs, alcohol, and crime. After Benjamin's presentation, we'll be having a Q&A. Please join in. I'll be taking questions from you via Twitter, so tweet them in with the hashtag MHJournalism anytime. Ask away. Before we get started, I want to say that this webinar today is made possible by a grant from the Tau Foundation to advance JJIE.org's in-depth coverage of youth justice issues, including underwriting the JJIE's New York City News Bureau at the CUNY Graduate School of Journalism. So without further ado, I'm going to hand it over to Benjamin Chambers.
Thank you, Katie. Really appreciate it. I want to thank you and JJIE and also the Tau Foundation for making this possible. So I was talking about the Juvenile Justice Resource Hub, which was developed with NJJN in my role at NJJN. And the purpose of the hub is to basically provide, it's not to be exhaustive, but it's basically to provide essential information about key issues in juvenile justice reform. One area of that hub has to do with mental health and substance abuse disorders, and I recommend that you check it out. I will also be presenting this URL again at the end with some other resources. We're still developing the hub, but we now have topics on community-based alternatives, indigent defense, and evidence-based practices, as well as mental health and substance abuse. In any case, I am thinking today, when I was thinking about the presentation, I was thinking about who I would be speaking to. Obviously, people who are journalism students are interested in reporting on kids and mental health was my primary concern. But even if you don't fit into that category, the goal today is to really provide some basic facts about teens and mental health issues as we know them, and some tough issues, tough questions that relate to social policy in terms of how we handle the convergence of mental health, alcohol and drug treatment, and kids in the justice system. To that end, there's a few takeaways I am hoping that you will have at the end of this presentation. I'm not going to go into huge detail, but these are the things I'm going to sort of want to plant as seeds in your mind. First of all, the treatment works. This is pretty well established. This is true for mental health treatment as overall. It's true for substance abuse treatment. But it's often confusing to people because we see people cycle in and out of treatment. So the important thing to know is that it works, but it's complex, and what it takes is a long-term commitment in terms of providing services at the system level. When treatment doesn't work, when you see a kid fail out of treatment, quote-unquote fail out of treatment, or not engage in treatment, I want you to consider the possibility that it may not be the youth's fault. We'll talk more about why that might be. And then also, I want you to be thinking about ultimately that the probability is that the juvenile justice system is really not the place to treat kids for mental health and substance abuse issues. We always will need to, and we always will, but treating it as a default treatment system is probably not a good idea. And then finally, the final idea I want you to walk away with is that kids in the justice system, in or out of the justice system, really need a lot more than treatment to be successful. So that's where I wanted to start. Those are the things I hope you walk away with. So I want to start with this question of prevalence. Like, how common is it for kids to have mental health and substance abuse issues in the justice system? There have been some studies, the sort of bigger, sort of authoritative studies. In 2006, Joe Koza and Schufelt found that about 70% of the kids in the justice system had at least one mental health disorder. In 2011, Gail Wasserman and her colleagues did a more in-depth study and found that about a little more than half of the kids had at least one mental health disorder. You're going to see those kinds of discrepancies in terms of numbers just because it's difficult to kind of to estimate. You know, you're always looking at sample sizes, so you're going to see some variation in that. But it's clear that a lot of kids have these issues. But the thing I want you to kind of think about is this. This is a slide I took from a presentation by, or actually a blog post by Dr. Jeffrey Butts at the John Jay College of Criminal Justice. And he basically was summarizing some of Wasserman's research. And look at these two bar charts on the right here. And you'll see that what Wasserman found was that it really depended on what part of the system you were looking at in terms of prevalence. So youth at intake, who are just hitting the door of the juvenile justice system, you're going to see a lot lower percentages of kids who have mental health and substance disorders. That's obviously, it's greater than the number in the general population, but it's still a relatively small percentage. But as kids penetrate the system, so if you look at kids who are actually detained, you start to see higher numbers of kids who have mental health or substance abuse issues. And obviously, once they end up in secure lockup, you're going to find really high percentages. Now, the other thing to kind of bear in mind is that multiple issues are common. Now, this slide is taken from a presentation by Michael Dennis at Chestnut Health Systems, and it's actually based on a large data set from the Center for Substance Abuse Treatment, which includes adults and teens, but the trend is still the same. You see kids who are presenting for substance abuse issues that have multiple issues. Generally, they don't tend to have just one. And that's also true for kids who show up with mental health issues as well. It's not uncommon to see multiple issues, which makes it treatment and addressing those issues more difficult. One of the key things you're going to run into that we are becoming more aware of in the juvenile justice system is the prevalence of trauma. Now, trauma is essentially defined as an experience that threatens your well-being, your life, your safety, your well-being. And it can, if it happens in childhood, it can lead to post-traumatic stress disorder, although that's a disorder that has very specific criteria and that kids don't always qualify for that. But it's understood now that this is a relatively frequent problem that kids in the justice system have, and it makes treatment and behavior change much more difficult if you're not addressing the trauma. I should add, by the way, just as a footnote, that the recent Attorney General's report called Defending Childhood, which came out last year, also really documented the prevalence of trauma and exposure to violence that many kids, both in and out of the justice system, have. Here's why this matters. Victimization or witnessing violence leads to a greater risk for mental health issues, behavioral problems, substance abuse, and surprise, surprise, delinquency. And in fact, the impact can last, can affect a kid throughout his or her life. The other thing to know, though, is that effective treatments do exist. And there's a resource at the end I'll be pointing out that does actually name some of those specifically. But this is I mention this just because it's an increasingly, people in the system increasingly recognize this as a factor in addressing kids' behavior and their mental health issues. So here's the good news. First of all, treatment has been shown to have a positive impact on public safety. Now, what I'm showing you here is pulled from the Pathways to Desistance study, which is the largest study ever done on teens who've committed serious crimes, largest longitudinal study. And they followed over almost 1,400 kids for 7 years. So they had a pretty good sense of their interactions with the system and what worked and what didn't. Not surprisingly, they found that a higher level of substance abuse significantly increased youth offending, but those with a substance use disorder were most likely to keep committing crimes. Now notice, I'm not talking about mental health issues generally, I'm talking specifically about substance abuse, and that it made things worse, basically, overall. what they found, the most startling thing really that they found in terms of treatment and interventions for these kids, was that alcohol and drug treatment was the most effective at reducing reoffending. And they weren't saying that mental health treatment wasn't important, because it was, but but the study was showing the largest impact in terms of their actual behavior change, in terms of not committing new crimes, was basically that came as a result of alcohol and drug treatment. But the key was family members had to be involved in a meaningful way, and treatment had to last a sufficient duration. We'll talk a little bit more. We'll come back to that study in a little bit later. Since we're talking about alcohol and drug treatment, I just want to say, just as a side note, you've probably all heard somebody say at some time or other, talk about alcoholism as a disease. They may have talked about substance abuse as a disease. This is a relatively new idea in the field. Now, it's been around since about 2000. It's had a huge impact, but I want to say that the important thing about this is it's not just a convenient metaphor. The revolutionary sort of way of thinking about this, the reason this has been so important as a way of changing our thinking, is that we are recognizing that substance abuse does have a biological impact. It has a medical impact on people. It changes brain chemistry. And here is the important thing here is that it can be managed. And this is also true, frankly, of mental health issues, but the study I'm referring to really talked about substance abuse stuff. That just like diabetes or other sort of things that we recognize as purely medical problems, addiction can be managed. It's cyclical. Adherence to the treatment protocol can vary over time, but it is something that is manageable over time. This is particularly important to keep in mind when you see people cycle in and out of treatment. You all know celebrities who've done that. This is why this model has been really powerful in terms of changing our thinking about it, because it gives us hope. Relapse is common, particularly for people who are younger, people who have mental health issues, or chronic pain, and a longitudinal study done by Chestnut Health Systems has shown that it takes an average of 3 to 4 treatment admissions over 9 years before half reach a year of abstinence. This is part of what I meant earlier when I said that treatment works, but it takes a long-term investment. People have to have multiple chances to kind of get through treatment. I haven't seen a study that really delineates this as the same thing for mental health treatment, but I suspect that it's somewhat similar in terms of managing the disorders and sort of staying, maximizing your quality of life. The other piece of the good news is that mental health treatment saves money. Now, I don't expect you to read all this type. You may not even be able to, the resolution on your screen might not even be that great. But what I'm showing you here is stuff that comes from the Washington State Institute for Public Policy. And they are probably the nation's sort of most authoritative source of research in terms of what works to actually change behavior and also help people be successful with sort of long-term outcomes, whether that's juvenile justice system or whether it's children's mental health, in terms of the money in versus sort of outcomes that we would like people to have coming out of treatment, and also, frankly, saving money for taxpayers. I will also have a link to their website at the end. Sometimes people don't really get how treatment, you spend a lot of money, depending upon the treatment program, it can cost a lot of money or it can cost less, it can cost varying degrees of money to treat people. It can cost a lot to keep the doors open, to provide, multiple episodes of care. So how does it save money? Well, the basic concept is that people who need treatment, who need substance abuse treatment or mental health issues, whether they're teens or adults, they don't just disappear. They end up in emergency rooms, they end up in court, they end up in detention, they end up in youth prison. All those things are incredibly expensive. And they're much more expensive than providing treatment, especially prevention up front. So I went through the good news, which is basically that treatment does have a positive impact for kids in the justice system in terms of public safety and in terms of saving money. But here's the thing about the treatment system. It's got some problems. First of all, a lot of people who actually need treatment can't get it. I was just alerted to a study recently done by folks at Harvard and Duke that was based on interviews with about 10,000 kids, basically trying to determine whether or not they had mental health disorders or not. And I'm not going to go into all this, but the gist of it was that the number of kids who actually saw a mental health professional very depended on, basically, the more problems, the more evident their problems were, essentially, the more likely they were to get treatment. So if they had one disorder, only about 12% of them actually had seen a mental health professional. That went up depending upon the number of disorders they had. Now, there was also a distinction in the study between seeing an actual mental health professional versus getting any kind of care. And you'd also see that people who had the kinds of disorders that are really obvious, like conduct disorders and ADHD and oppositional defiant disorder, versus those ones that are really hard to see, like panic disorders and anxiety and things like that, those all had an impact on whether you got treatment. But accessibility to treatment, access to treatment is surprisingly low. You'll see the same thing in substance abuse treatment. Now, I looked at this data a couple years ago, and that was when the 2009 data was most recent, but this stuff doesn't change that much from year to year. At that time, just a little over, about 1 in 10 people who needed treatment were actually able to get it. And about half of all of the kids who are actually getting substance abuse treatment are referred from the juvenile justice system, which I think is indicative of the fact that we're not catching these kids sooner. We're not catching them in schools. We're not catching them in other healthcare settings. There was also another study by Gail Wasserman that showed that only about half of juvenile probationers who had a substance abuse issue or a mental health disorder had actually access to treatment services. Returning to the Pathways to Desistance study, they also sort of corroborated that. They found that even though alcohol and drug treatment was the most sort of important thing to changing kids' behavior, most of the kids weren't able to get it. So basically, you've got a system where issues are underdiagnosed, issues like, as we've covered, substance abuse and mental health, but also crime and violence don't tend to get assessed when kids do get assessed. They don't get assessed for HIV or sexual risk behaviors, which, as you can imagine, is really important for teens, mostly because people are uncomfortable talking about it. Child maltreatment often doesn't come up in assessments, and kids don't often get asked about recovery environment or peer risk, the risk of the risky peers that they're hanging around with. So we're talking about a service system that is weak. I don't know if you see this picture, if you've ever played this game where you are trying to kind of balance this wobbly table to get the metal ball through the maze, and if you tip it wrong, the ball falls down through the hole. That's essentially what happens. We're trying to get kids through this maze of life and school and work and treatment, basically, and we lose them. We often lose them through the cracks. So basically, we have a workforce that is high turnover. This is especially true in the alcohol and drug treatment system, although I should say that the alcohol and drug and mental health systems are being integrated into the traditional medical systems, and some of this stuff may be changing. But right now, you have really high turnover. It's burnout. It's very sort of intense work. People don't get a lot of pay. They don't get paid well, and they don't get a lot of sort of emotional support for the work that they do. You're talking about kids who have a lot of issues. You're talking about kids who relapse, who move around a lot sometimes, so they end up with multiple kinds of care over, in many different places, and it can make service coordination really hard. Programs often don't have access to or don't use data that they have to help them really make better clinical decisions, to design their programs better. They don't get a lot of support, frankly, from states as a rule to do this, to improve the quality of the care. States are working on this, but it remains an issue. And then, frankly, there's just not enough. We expect treatment programs to use evidence-based practices. That's what the EBP thing stands for there. We expect them to use it, but we don't put enough money into staffing. Basically, it takes a lot. It takes more staffing. It takes clinical supervision to provide really good care. And oftentimes in public, especially public systems, the clinicians don't get a lot of oversight to make sure that they are both providing good care and also implementing the evidence-based practices with fidelity. And then finally, something else you need to keep in mind is that, I'm just talking about the urban systems. All these things are even worse in rural systems. In rural areas, they have a harder time attracting and keeping mental health professionals. They have to travel very long distances often to get to kids and families, or vice versa. Imagine if you're supposed to see a treatment therapist multiple times a week, and you have to travel a couple hundred miles to do that. It gets a lot harder. So the final thing I kind of want you to think about is that mental health treatment really just isn't enough. It's really important. I do not want to underestimate or take away from the importance of mental health and substance abuse treatment. But that even for kids who aren't in the justice system, anybody sort of who needs some kind of treatment, focusing on treatment and medication is not sufficient. I want to take you back to that slide I showed you at the start, where I was talking about the number of kids who had mental health or substance abuse disorders, depending upon where you looked. The other thing to notice about this graph, though, is how many kids don't have mental health or substance abuse disorders. So you have a lot of kids entering the system, but they don't actually have any of these disorders. So it's important to bear in mind that the kinds of supports and programming that we provide for kids needs to actually go beyond treatment. I'm not going to, this is a slide taken from Dr. Butts' presentation on positive youth justice, and I provided a link at the bottom there. But it shows sort of the difference between the general way that we look at juvenile justice and the way that we probably should be looking at it. In the traditional way, we tend to look at deficits, what's wrong with kids. We try to control them. We try to provide treatment only. We focus on sanctions and supervision. And of course, I'm generalizing. Certainly, systems do try to do some of the stuff in the right-hand column as well. But the default position we have is that on the left. So on the right, you have the positive youth justice sort of approach, which is focusing much more on strengths. Like, what is it the kids are actually good at? What can they do, and how do we attach them to responsible adults and positive peers who are going to actually motivate them to be successful in life? And there's a whole sort of approach to this that I'm not going to go into in detail, but the thing I really kind of want to underscore here is that any mental health professional will tell you that guiding somebody through treatment or to recovery involves more than just medication. It involves more than just therapy. It also involves trying to encourage them to get involved in pro-social activities, to connect with positive role models and so forth. There's very little funding in the system. This is not something there's no billing code for this. So it's very difficult for treatment programs to actually do this well. Juvenile justice systems also have a hard time doing this, again, because this isn't prioritized. So I want to leave you with a few questions. If you were actually reporting on teens and mental health, these would be things that should be in the back of your mind. First of all, do you have to get arrested to get treatment? And if so, why? We don't want to do what we call widening the net. You don't want to pull kids into the system just because that's where you can treat them. And the reason for that is that diversion is more effective at addressing delinquency than formal system. So you pull them into the system, you're going to make them, in general, not every kid, but many kids are going to be potentially more likely to commit new crimes. Formal processing can backfire, especially with high-risk kids. And placing kids in an institution doesn't affect their rate of rearrest, and I'm talking about secure institutions as well. So incarceration sort of can expose kids also to violence and abuse. So all these things are actually kind of harmful for kids. So the question we really need to be asking ourselves is, shouldn't we do everything we can to treat kids outside of the juvenile justice system before they get to court or outside of the court system? Certainly we're going to have to continue to provide treatment there, but this is something we need to be thinking about in terms of how we provide and structure our services. Secondly, in terms of my tough questions, how do you screen or assess youth and protect their due process rights? Everybody, kids and adults, have, under the Constitution, due process rights when you show up in court. These are basically designed to protect you from sort of, unnecessary involvement in the court system. The problem is when we get kids who have mental health or substance abuse issues in court, we naturally want to help them. Unfortunately, the tools we generally have to help them tend to be within that court system. They tend to be coercive, and they tend to be sort of unnecessarily invasive. As an example, confidentiality is often kids' confidentiality is often abrogated. People don't talk about this much, but treatment professionals have under the federal law, actually have a responsibility to protect their client's confidentiality. That means that when they do an assessment on a kid, they should be providing only a diagnosis to the authorized people that they are sharing information with, like probation officers and so forth. rather than, but what often happens is they send a full assessment, which often has a very long narrative about all the kids' problems and all the kids' sort of issues in their family and so forth that they've had over the course of their lives. The reason that this happens is the probation officers really want this information. They feel like it's really helpful to them in terms of managing kids successfully, and they may be right. But the fact is that this is information that's obtained in a situation where confidentiality should be maintained. So this is an issue. This sort of conflict between the probation officers and so forth are not similarly governed by federal law. They have different confidentiality requirements than treatment folks. They do have confidentiality concerns, but some of these assessments end up in kids' files and floating around for people who actually shouldn't be seeing them. Another big question is how is treatment paid for? This is obviously changing under the Affordable Care Act, but it has historically limited what kids get, what services they can get, especially in the public system. For kids who are treated on probation or in an institution, what happens when they leave it? This is a really important question because you can calm a kid down, you can get them sober, you can do all kinds of things when you lock a kid up. But the problem is you send them out back into the community where they're back with their risky peers, they're back with with their conflict maybe with their families and so forth. How are they going to be successful? You really need a good step-down plan and a good continuing care plan so that they're continuing to get care and that they are comfortable accessing it when they leave. And then finally, what evidence is there that whatever local treatment program they're in is actually working? I don't just mean, yes, they say that they're using an evidence-based program, but do they actually evaluate it? Do they actually have sufficient staff and training, and does the staff have sufficient training and clinical supervision to implement that practice? So just returning very quickly here to summarize, I have talked a little bit about the fact that treatment works. I've talked a little bit about how complex it is and why long-term investment in it is needed. I think I've provided some reasons why it may not be the kid's fault when it doesn't work. If they're not engaging, it may not be their responsibility. I mean, it's their responsibility, of course, to show up for treatment and so forth, but they may not be entirely at fault for not engaging. It may be a lack of service coordination or other things. I think I've hammered home the idea that the juvenile justice system is really not the place to treat kids for mental health and substance abuse issues if we have any choice at all in the matter. And finally, that kids in the justice system really do need more than treatment to be successful. I just listed these key resources. I believe we'll be sharing the presentation with you. I just want to call out the last two. This 10 things every juvenile court judge should know about trauma is a really great, brief guide to trauma in kids in the justice system. You don't have to be a juvenile court judge to benefit from it. And then I also want to call out Dr. Butz's site, Positive Youth Justice, which really talks a lot more about the positive youth justice approach and talks about some sites around the country that are trying to implement it. And that's it.
Great. Thank you, Benjamin. That was excellent. I have so many questions. If you're just joining us, we are talking with Benjamin Chambers, a writer and editor specializing in juvenile justice who currently works as a communication specialist for the National Juvenile Justice Network. If you have questions, we'll be taking them now. Go ahead and tweet them with the hashtag NHJournalism. So let's dive in. Benjamin, I want to start with a couple questions about why family involvement is so crucial and how to keep families involved if they are resistant or far away, et cetera, et cetera.
Those are great questions. Well, first of all,
quickly, can you click? You're still screen sharing, so I'm like looking at myself.
Oh boy! Whoa! Boy, that just.
Whoa!
Sorry
Whoa!
about that. I'm gonna switch
That was amazing. That was amazing.
There's a little.
There you go.
Is that better? Okay.
That's better. Okay.
Well, first of all, family involvement is it's important. First of all, think about where teens are developmentally. Unlike adults, most of them still live at home, or they're still sort of maturing, and so their relationships with their family, whether it's their parents, their extended family, anybody that they consider family, basically, siblings or step siblings or whomever, all those things have a big impact on both their psychological well-being and their development. So all those things really sort of impact how successful they are. It's also true that, I mean, because of that, because they often live at homes, or they often have very little control over a lot of things that adults do. They can't change their environment easily. They can't just, I mean, sometimes they move out, but mostly they can't. And so all those things sort of have an impact on why it's really important. And probably, I mean, there's more that I'm not going into, but in terms of addressing, I think your question about resistant families is certainly astute. Any probation officer, any treatment person will tell you it's easier said than done to involve families. A, because on a practical level, if your kid's going to treatment 3 times a week, or 2 times a week, you're going to have to take time off from work to go do that. That costs you money. Your boss may not support that. I mean, there's all kinds of reasons why, just on a practical level, it can be very difficult to participate. You can get around that in some ways. Sometimes you can call in. Sometimes you don't have to be there for every session. I mean, there are ways to kind of address that. Ideally, you're providing treatment at a time when the parents or I should keep saying parents, but I should say sort of any sort of key family members, caretakers, whomever are able to make it. There are also protocols that do a really good job that are very aggressive about making sure they take the treatment to the family. Multisystemic therapy is an example. Functional family therapy; those are examples of really, and brief strategic family therapy, and there's a few others. But a lot of the ones that have family therapy in the name, obviously, really prioritize that, and they do. I mean, they do a really. They don't accept sort of participation. It does happen. You're going to run into situations where it's just not possible, and either because the kids can't be in the home, or it's dangerous. There can be all kinds of reasons why that's not possible. But those kids are relatively few and far between. I shouldn't say few and far between, but they're relatively uncommon. And the challenge is having a system that is able to fund that kind of aggressive family involvement, because it does take time and energy to kind of make that happen.
Yeah. I've also heard in my experience or involvement in families or the courts, I've heard sometimes parents sort of like throwing their hands up in exasperation and saying, well, maybe he or she needs to go in to get clean, to straighten out, etc. And I know you sort of addressed that right at the end, saying, like, no, you don't need to get arrested to get treated. How do we engage parents in understanding some of these more complex things that have been researched and that have been proven to not work, I guess?
Well, I guess what I would say, first of all, is that parents, by the time they hit the juvenile justice system, they're fed up. I mean, they have tried a lot, and I really want to say this isn't a failure of sort of imagination or whatever on the part of parents. I mean, they have been struggling with their kids very likely by this point for a long time, and whatever they've tried, either they haven't been able to get access to care, they haven't been able to afford it. For whatever reason. I mean, there's a lot of reasons why, and certainly it's like if you have a kid who's out of control or feels like they're out of control, it feels like what you need is you need a probation officer, you need detention, you need to lock the kid up, and that's how it can feel. So I really want to say be empathetic in terms of parents in that situation. I think it's really more it's more of a sort of a policymaker responsibility to start rethinking this. So needing to make sure that we are identifying these issues much earlier. Schools are an obvious place, but also traditional medical, sort of doctor's offices and so forth, beginning to sort of identify these issues earlier and having a system that can address them effectively is going to be really important. We're always going to have some of those kids who are going to end up in court. I know, but that's not an excuse for accepting it. We should be working as hard as we can to make sure that they don't have to end up there. I think there are family therapy. The thing that works, and the reason that family therapy is really important is that it's one of its key jobs is to often, not always, but is often to kind of reestablish authority. Parents, by the time they hit the court system, so they've been dealing with, either kids who actually have mental health issues or not, but in any case, they tend to, there's a lot of sort of conflict and so forth, and reestablishing sort of some mutual respect and limits, and helping parents enforce those limits is a key part of family therapy, and that is something that could be done outside of the system. But family therapy is expensive, so that's why you don't see it as much as you should.
Yeah. Let's jump into a few journalism questions for young journalists who are maybe curious about the system or want to start investigating the system, but don't know where to start. First of all, what advice do you have for a young journalist who wants to work directly with young people dealing with substance abuse or mental health? Why is it important for them to have a grasp of the system? And what are some key sort of behavioral things that they might need to know effectively engage and interact with and pull stories from, families and these children?
So I'm going to make a few assumptions about this question, or this set of questions.
Go for it.
I think what I'm hearing is that the idea is that you would want to actually kind of do a profile, say, of the kid, maybe the situation in the system. So I think it's hard because you're talking about teens, so confidentiality is an even bigger issue in terms of treatment. But it's not impossible. There are ways to both hide their identity, either with initials or other ways to do that. I do want to caution folks that it's ethically really difficult, complicated, because a kid may say, yes, I want to do this now, I want to help other kids, I'm happy to be on the front page of the newspaper, and their parents may say, sure, that's okay. And then it hits the front page of the newspaper, and then they may regret that. Because they can't necessarily really see ahead to what that's going to look like. Or they may regret it in 3 years when they're trying to get a job. So I would just really strongly encourage you to be very thoughtful about how you approach kids and families. There were a whole bunch of questions that I've kind of that wrapped up into that one, but one of them I think had to do with like how you connect with them, basically.
Yeah.
So on a practical level, I think it's going to be hard because if you approach a treatment program, if you approach a juvenile probation office, that's where you're going to find them. The tricky part is setting parameters where they are going to trust you to because their ethical responsibility is to protect the kids, and so they may not want to sort of encourage you to kind of tell these stories. But I think if you set sufficient parameters, you can do that. I think if you really, really want to get the kind of experience, sort of understanding sort of where teens are coming from and who have these kinds of issues and so forth, I would sort of go into it without necessarily planning to do a story. I would do it either through mentoring or in some other way sort of participating in some kind of pro-social activity that's designed, where kids are doing maybe a cleanup day or something like that. Participating as a responsible adult with no expectation of actually doing a story. But I think you're going to get a much better sense of kind of the kids and kind of what they're dealing with, and you may also develop the kinds of relationships that you're going to need in order to get the trust built to get those stories written. I hope that's helpful.
No, I think that's really helpful. On that note, are you familiar with Michael Nash, the judge in LA County, who opened up the child dependency proceedings to the press?
I remember reading this was a couple of years ago, right?
Yeah, it was a couple of years ago. With the idea of sort of like shining a light onto a largely shadowy system, and it makes me think, there's definitely good and bad. There are ethical dilemmas with that. That gives the judge a lot of power, a lot of like leeway to decide who comes in and whose story leaves the courtroom. Do you have any thoughts on that?
Well, my understanding actually is that I think it varies by state and jurisdiction to what courtrooms are open to the public. Oftentimes they are open. People don't necessarily take advantage of it, and I can tell you it can be uncomfortable to walk into a courtroom as a member of the public when it's not something that's usually done.
Yes.
The judge may well call you out on it. That doesn't mean you may still have a right to be there. I think it's interesting. I think if you can watch those kinds of proceedings, I think it's enormously educational because you're going to learn a lot about how long these kinds of cases go on for, whether it's child welfare or whether it's kids in the justice system, how complicated they are. You'll see kids and their families, and you'll see a lot that you won't really see otherwise. At the same time, I mean, I think that's again, I think it depends kind of on your motivation and kind of why you're going there. But I think it can be for somebody who just wants to kind of get a sense of one piece of the system. And remember, that's only the tip of the iceberg. It's like there's all this preparation that goes into those, court hearings, all this legwork that goes in, the people, the caseworkers are putting in, coordination that's going into it or not going into it. But you begin to see kind of where the pressure points are if you get to see those kinds of proceedings. Yeah. Yeah,
definitely. It can be very informative.
I mean, sorry, another thing that might be good to see is juvenile drug court. Partly because it can be really, if you get to go to a graduation, it's really exciting. You get to see a lot of kids and families and parents who are just, tearful and the kids are tearful because they've gotten through this. It's often a very long process. I do want to say, just as a caveat, that juvenile drug courts, that research on juvenile drug courts is not as like adult drug courts is very clear. In juveniles, it's not nearly as clear that they're effective, but they're very common. So it can be a really great way to kind of get a sense of the system and the kids.
Yeah. On that note, drug court, collaborative court, girls court, and various things that I've heard of where people are doing alternative things to sort of work kids in the system and out of the system in a better way. So is there a state or county system that can serve as an exemplar right now for like positive justice, pro-social at its best? Is there a way to nail that down?
Pardon, what was that?
Just like, can you even focus in on that, I guess?
Yeah, first of all, I would recommend positiveyouthjustice.org is actually starting to list some model sites. One of them that I'm familiar with is Clark County, Washington, which is, I'm in Portland, Oregon, they're right across the river. They have done a lot to change their orientation in terms of community service and the kinds of things that often are treated as sanctions. They're really trying to build in very pro-social opportunities for kids. So they don't have kids picking up litter on the side of the highway. They've got them doing sort of more productive things that are rewarding for the kids as well as for the community, where kids learn actual skills and so forth. And they've been pretty thoroughgoing in their approach to it. And I would really strongly recommend anybody who's interested in that to contact them for more information about it.
So I have a question from Twitter that's a good segue. How well are journalists sort of gauging the current state of media covering these teen mental health issues?
I don't want to say that I'm totally up on it. So obviously I'm speaking. What I'm trying to say is I'm speaking just purely from my own perspective. I would say it varies. I think. And I don't think that people end up covering this problem when kids do something wrong. A kid does something wrong, when a kid on probation does something wrong, when a treatment program screws up in some way, maybe a kid commits suicide or does something horrible and so forth. So then the spotlight goes onto those systems. That tends to be when they get covered. There are occasionally you have positive profiles, or you have coverage of things like Scared Straight, the TV show. By the way, the research is extremely clear it does not work. It's actually it's harmful, and in fact the cost-benefit analysis done by the folks in Washington has shown it's one of the few things that actually really costs money because it's so ineffective.
Wow.
But that said, they've done a great job of getting a lot of media attention on these kids. So you get this. I think the problem is that journalists have very little time to kind of cover these issues. They're supposed to write about somebody who's been involved in very complex systems over time, I think it's easy in some ways to blame the kids, which sometimes happens in this kind of coverage. Because the kids had this long, sort of history of sort of misbehavior and treatment that didn't take in some way or other. Then you end up sort of the kid ends up looking like a real problem, and the kid may well indeed be a problem. I shouldn't say that they're not, but I think stepping back and really taking the comprehensive look, I think can be hard. So I think another thing I would recommend for folks who end up writing these kinds of stories is definitely reach out to. You're likely to have local experts, your local university or whomever, for a perspective on it, because they'll be glad, I think, to offer you some useful perspective that'll round out your story.
Yeah. Yeah, I also want to say, jumping off of that there are so many, in great news, organizations springing up that are bringing families together as sort of like resource hubs together, especially in rural areas where it's really needed. And they are oftentimes very willing to share stories or talk on the phone, have a conversation. They are incredibly knowledgeable, unfortunately, after going through the system, and they are very willing to speak with you. And I also encourage you to form a relationship too, and listen to them and hear them out, and respect their privacy if they don't want to speak. My last question is maybe a bit of a can of worms to open, but I know as a journalist thinking and writing about this that I've got a lot of questions about evidence-based treatment. And what that means, and where that term is vetted, where it gets to be what it is. How does it come to be evidence-based, and is that like standardized, I guess?
No, I mean that's a great question. So I'm going to step back just a little bit. I know more about the development of evidence-based practices in the substance abuse treatment system than I do in the mental health system globally.
Sure.
But it's similar. I mean, about when I started working in the system in the year 2000, they were already sort of in a state of change. But it was not uncommon to send kids who needed substance abuse treatment to treatment that was really designed for adults. The recognition of the developmental needs of adolescents and how that might change treatment was only beginning to permeate the system. Mm-hmm. Because of a big investment of money and resources by SAMHSA and their Center for Substance Abuse Treatment at the federal level, which went on for a number of years, they have really turned the field around in terms of both funding research in terms of what worked and also disseminating it, sort of helping people begin to implement it. So, and that's somewhat true on the mental health side too. I mean, like basically what's ended up happening is that in the last 25 years or so, we've really developed a lot of programs that have been researched so that they are sort of researched in the lab, so to speak, and they get tested in multiple sites. Mm-hmm. And they're replicated. And if they can be replicated with faithfulness, then they sort of rise in terms of their and work with different populations and so forth in terms of rise in terms of their level of authority and sort of evidence, the evidence that sort of is behind them. Mm-hmm. There's an issue in this, in that unfortunately a lot of these, there's a little bit of a financial piece to this, in that if you develop one of these kinds of trademark programs, then and you're doing the research, I think there's a question of on whether it's effective or not. I think there's a question about sort of how much. But basically, essentially, what we want to do is we want to make sure there's plenty of independent sort of research and sort of verifying those results. Mm-hmm. And there is a fair amount of that beginning to go on. So there are standards. They vary a little bit. So the Office of Juvenile Justice and Delinquency Prevention has a model programs guide. I believe that's what it's called. If you Google that, you'll find it. They have a lot of different kinds of prevention and intervention programs, not just for mental health and A&D issues, but generally some behavioral issues and so forth. And they rank them in terms of this is sort of promising program, and this is one that's got a little bit of evidence behind it. This is one that's got a lot. And there's also Blueprints for Violence Prevention, which they changed their name recently to, I think, Blueprints for Healthy Youth Development or something like that. But you can Google them. They're based out of Colorado, and they really started that. Mm-hmm. They have got they have a very rigorous sort of evaluation sort of protocol to determine kind of what's really working. Then you've got, there's a researcher called Mark Lipsey who's done a meta-analysis of, which basically he's looked at over like 500, I think it was over 500, but quite a lot of sort of research on what works, and really found principles, common principles that sort of help, so that if you don't have the money, if you're a jurisdiction that doesn't have the money to invest in this stuff, that there's a way that you can learn from the research to make your existing programming better and make it effective so that it is as effective as it can be. And there's research that shows that what matters isn't so much like if you buy like the most effective program at the cost you the most. What matters most is that you buy the best program you can afford, but that you implement it as best as, as faithful as you can. So there has to be some oversight and evaluation to make sure that you're doing the best job you can to implement the model as it was designed with the population you're serving. And that is the final caveat, is that a lot of these things, these programs, even the best of them aren't effective with everybody. And they're not necessarily effective with every kid. Some of them have to be appropriate to the community you're serving. And that can be, providing a full menu of those kinds of services can be expensive and difficult, and that's another challenge the systems face. So.
It's a complicated system.
Yeah.
Well.
Yes, it is.
Well, it's time to wrap it up here. Thank you again for your time and sharing your knowledge with us. And everyone, this broadcast will be available on jjie.org. Right now it's on the homepage. You can watch it. It'll be archived on our YouTube channel as well. And I want to again thank the Tau Foundation for making this webinar possible, and for advancing jjie.org's in-depth coverage of youth justice issues, including underwriting our New York City News Bureau at the CUNY Graduate School of Journalism. Thank you, guys.
Thanks, Katie.
All right. Thanks, Benjamin. Bye.